All right, welcome to Foundations of Public Health. We're so excited to see you all. We've been watching your emails and learning a little bit about you, and today we're all going to get to know each other a little bit. And I can't wait to hear what everyone is going to bring to the game. So, welcome everyone. It's going to be a great day. Let me know if anyone has any questions. There's space in the chat to ask a question anytime. Um, I love chat feature in Zoom. It's basically passing notes in class the whole time, and it's highly encouraged. Part of the purpose of this activity is to get to know people, and you are welcome to and encouraged to use the chat. We will ask you lots of questions to use during chat, so we hope to invite you to use that space. All right. Um, okay, we're changing up our order of activities today. So eventually we are going to get a little welcome message from our friends at KDHE.
Ready to connect via
But they are
Bluetooth.
beginning a different activity right now. So they are going to give that a shot when they can join us later. So they're just going to pop in and we'll hear from them. And our schedule today is super flexible. So we will just welcome their attendance when they join in. All right. Let's start with some introductions. Hi, I'm Sonia, and I'll tell you more about me. I would love to see any one of you add a question in the chat. What would you like to know? Emily and I are going to be your co-hosts, your directors for this program. What are you curious about us? And also, we'll tell you a little bit about us. So, Emily, you want to go ahead and introduce yourself, and we'll see if anybody has any questions that they'd like to know about us.
Yeah, good morning. I'm Emily Brinkman. I work with Sonia at the WSU Center for Public Health Initiatives, and we're so excited to kick off group two of you guys joining us. So I look forward to learning from you and with you as we go along this.
All right. All right. This is like that first day of class when everybody's quiet. And then, like, in the third day of class, everybody's really talkative. So, the big challenge I just gave you guys was generate some questions. What are you curious about? What would you like to know about these people who are going to be leading you in this work for a while? You're just like, I don't care. You're in charge. So, I'm just going to roll with whatever you guys bring. While we wait for your questions, I am also at Wichita State's Center for Public Health Initiatives. My name is Sonia Armbruster. I've worked in public health for 20 plus years. So lots of different activities. Okay, now we got some juice. Loving seeing these questions. Hunter, what does a good leader look like to you? What a fun question. I love that question. I think it depends on the context. So there's a lot of different places where we see people exercising leadership. And I'll tell you the first thing that came to my mind when you shared that. I worked for an amazing health director named Claudia Blackburn, and I just really loved her. And I'll tell you three things I think she did that made all the difference. One, she understand that her role as a health department director was to mobilize her community. So she was externally facing almost all the time, engaging with community partners. She really took the lead on that. Second, she invested in her people. If we wanted to learn or try something, she sent everybody off learning and trying things. She really invested in people and trusted us to figure out what was going on. And third, she showed a lot of heart. Like, one of her big things was at the holidays, she baked like crazy for everyone at the health department and just brought tons. Like, there were 150 people and she baked for everyone. So like, that's just, she just showed her heart through food, which I loved. All right, Lori has a question for Emily.
Sorry, I was sending Rachel the meeting ID and passcode. So, and
Cool.
anybody else who needs that. Let's see. What brought me to adult education? Um, I would say I've been in informal adult education for, I don't know, 12, 13 years now. I started with the Department of Education with the child nutrition programs. And a big part of my job was doing workshops and trainings to teach school nutrition professionals about nutrition with children, with the school meal regulations. And that was just my favorite part of the job was passing on that information and getting to learn with everybody as we went along and um, learning what everybody knew, what the gaps in information were, and passing that along. And then I moved on to the WIC program with KDHE, and same thing. I loved that teaching part. I've never been, I should say, we're with Wichita State University, but we're not with the Asanya, you can probably explain better what our center is in relation to WSU, but we're not actually with the education portion. At least I'm not. So, but I love that informal adult education that I've been doing.
And I'll tag on since Lori invited. And so I my undergraduate degree is in secondary education. I've been teaching professionally since 1994. I love teaching. I think maybe I was born to do it. That's like a passion for me. I took a left turn when I was in grad school when I got invited to do some research with a University of Kansas School of Medicine, preventive medicine department, and I've been in public health ever since. I did teach for 5 years in the public health sciences program at Wichita State, so on the academic side. And I love teaching and I love students. I don't love grading. And in this program, I get to teach and not grade. So these are things that I love. That's a really full out honest thing. Favorite aspect of public health, Emily,
Hmm.
or answer Afton's questions about what you would have to pack if you had to leave in a hurry.
I'm going to answer my favorite aspect of public health. That's easier. Um, I love the prevention part of public health. I think what brought me to it is I started in long-term care and as a dietitian there, and just seeing the chronic diseases that plagued our residents and how hard it is to catch up later in life. I love the prevention part of public health where we're taking care of our community to try to prevent those chronic diseases before they happen so that everybody can live a healthier life.
I
I'll
love
let
that.
you answer the what you'd pack, Sonia.
I love these questions. Okay, just so you guys know, you are in good hands. You are in the hands of two master facilitators who have an agenda that you can't see that's broken up by every 5 minutes. So just so you know, we're over time to spend on this question. So we will answer some of these later as we go along. What would I pack if I had to leave in a hurry? I mean, like, I don't know. My best running shoes. I don't like. If I had to leave in a hurry, like forever or like to go to the store
No, just for like a day or two.
for a day or two, I'm so low maintenance, extra underwear. I mean, like all this stuff. I don't know that. Okay. I love that question though. I'm going to keep thinking about it. All right. Well, welcome in, friends. We're off to the races. We have 20 minutes on our schedule today to spend some time getting to know you all later today. All right, Emily, you want to talk about these objectives, and then I'll do a quick orientation to what's on our website.
So most of today is going to be just getting you oriented to what we're going to be doing for the next 8 months. We're going to get you familiar with what the Foundational Public Health Services is, because that's how we've built this course. What are the expectations for being in this program? And then we're going to take a little bit of time to talk about health equity and the social determinants of health and that impact it has on overall health, because that'll set us up for the rest of the course, since health equity really is the core of what public health is based on. It's going to be fast. We have a lot of resources for you to help expand upon it, but we will be going through this all really quickly. We are recording, so you can view back later if you need to. And we're always here to answer more questions if you want something covered in more depth.
All right, so that was the orientation to the day. If you are curious about where to find all this information, how can I find, I don't remember the email or I can't find this information. We have a website that is dedicated just to this class. And We just basically, I feel like we took a big squeegee and wiped the whole slate clean. And all of the boxes that you see on our website are now empty again because we're filling with new and different content for for this year. Actually, let me share screen real quick and I'll just walk through what's there.
Mhm.
I'm gonna place current share with. So I just dropped the link in the chat. You can all see it there. On this Kansas Public Health Collaborative.org public health FPH foundational public health resources. On that page, we have the things for today. So we're going to be walking through the participant handbook. You all received this agenda already. You have bios for all of the people who are in this program. In the next 20 minutes, we're going to be hearing from everyone in this program, tell a little bit about themselves. If I were you, and this is what I'll be doing, I'll have like these bios open on my second screen so I can kind of get a sense for I'm reading about this person on their bio and I'm hearing from them on the screen. We're hoping to build your connections and networks, and hopefully that will help. If you want to see who our subject matter experts are going to be, they're here. All of the things we're going to cover and all of the resources you need to see are on this page. So just wanted you to know that that's there. We're not hiding anything. It's all available for you to find and see. And we've encouraged your questions. All right, I pass back.
All right. So, like Sonia said, we're going to take some time now, giving you an orientation to the day. We'll dive more into the course and all of that in a little bit. But first of all, you're going to be spending 8 months with us and with each other. So we want to make sure we know who you are. You know who you are. So thank you all for sending me slides of who you are. We were trying to figure out last year we did our kickoff in person and we weren't able to do that this year. So we're like, how do we get to know each other a little bit better when we're meeting virtually for the first time? And I've loved seeing all these slides that you guys brought in. What brings you joy? Because we're more than just who we work with and what we do for our work. So we want to get to know that part of you as well. So we're going to take a few minutes here to get to know each other. I've got Sonia up first. We're just taking this super quick, like 30 seconds to a minute tops. Just let us know who you are, introduce yourself. You can tell us where you work, what you do. And if you want to talk about what you put on the slides, you can. I will also be sharing handouts of the slides, so everybody will get to see these fun pictures that you shared and know a little bit about you, in addition to what's in those bios that Sonia shared.
All right, so Emily and I are going to offer you examples of what this might look like. So hi, I'm Sonia Armbruster. I work for Wichita State's Center for Public Health Initiatives. I live in Manhattan, Kansas, so I do most of that work remote, which works great for meetings like this. When I'm not doing work for Wichita State, I'm doing work for the Public Health Foundation, and I'm a performance improvement consultant. So I do QI, workforce development, et cetera. So like later this afternoon, I'm doing a workshop for Multnomah County in Portland. That's just kind of a typical day for me. And joy for me is spending time with my family. And you can see my family on my screen. I also spent a lot of time at K-State. Like I was at the baseball game last night. All right, Emily?
Hi, I'm Emily Brinkman. I also work for WSU Center for Public Health Initiatives, but I live in Lawrence and work remotely from here. You can probably see on the screen that even though I say I live in Lawrence, I'm a K-State fan as well. We're just transplants here. We love the town, but we also love flying our purple flag from our front porch and just antagonizing our neighbors. It's all in good fun. Other things I love to do, my husband's trying to get me into golf, my kids as well. So I love being on the golf course with my family, and I'm also trying to learn tennis. I'm kind of a homebody. I love to read, craft, try new things. I have a craft closet full of stuff because I just like to try things, and then I move on to the next project. So those are the things that bring me joy in addition to my work and my work friends. And so I've got everybody in alphabetical order. So we'll see who pops up next. Megan Kleinsmith. would you like to introduce yourself?
All right out the gate. Can everybody hear me okay?
Yeah.
I'm not the best with the Zoom. Okay, well, my name is Megan Kleinsmith, and I live in Buffalo, Kansas, actually. It's just a tiny little spot on the map, very rural, live in the middle of nowhere with my husband and two boys and a couple cows. So they're pretty remote, but I work in Yates Center, Kansas, and I work at the health department here in Woodson County. So I've been in this role since May of last year, so not quite a year. So I again said that my background's in surgery. I did that for about 10 years and then decided the call was a lot and I was tired of my husband playing the Easter Bunny and getting to do the fun things. So I took this job in public health and I feel like I've been blasted into outer space. And so I'm really interested in this course just to get kind of good foundations and get my feet on the ground.
Fantastic. Thank you.
That's really about it. Thank you.
Hunter, it is your turn.
Hi, everyone. Can you hear me okay too?
Yeah.
Okay, perfect. Well, my name is Hunter Davenport, and I work here at the Sedgwick County Health Department. I am the enrollment specialist for the Healthy Babies program. We're a home visiting program that kind of work with pregnant moms and moms that have just delivered for about a year and a half after giving birth. Things that bring me joy are my two daughters, of course, my husband. I love watching makeup videos. I don't do my makeup like a whole lot, but I live through the videos that I watch. And then something kind of different about me is I love to watch movies over and over and over. Um, I've met people that, they one and done, they're done with the movie, but I can watch movies over and over. So those are a few of my favorites. I love Bridesmaids, I love Couples Retreat, and I love Billy Madison. Um, and kind of like with what Emily said, I have a whole craft box. I start a craft, work on it 5 minutes, and move on to the next. So I love crafting and DIYs. But I'm very excited about this course, and thank you so much for allowing me to be here.
Yeah. Okay. You have to tell me, is it Lakia or Lakia? I want to make sure I'm saying it right.
Oh, it's Lakia.
Lakia. Okay, thank you.
Yeah, no problem. Well, hello. I'm Lakia Dupree, and I'm the community outreach coordinator here at Hunter Health. I'm just coming up on 3 years here, and yeah, it's good to see you again, Sonia. I was in her class when I went to WSU, but I some of my joys include, of course, my family. I'm the oldest of six, so I kind of take care of all my, well, be a big sister. And then I have a dog named Cooper. I really love spring weather, and I'm hoping we get some good weather, this how I chill out a little bit and, you know, um, I mean, I have this little meme on here that I have to write a list because I am writing lists all the time and sometimes losing them. But, it's just an easy way to get my thoughts out, I guess. So, thank you.
Yeah. All right. Who's next? Jerry.
All right, can you hear me okay?
Yep.
All right. I'm Jerry French. I work as a medical assistant and biller at the Ellis County Health Department. You can see on my slide that my family and my grandkids are my biggest joys. I love being outdoors, playing with my dogs, working in the garden. And when I can't be outdoors, I love to be inside doing arts and crafts and coloring. Color by numbers are my favorite because you don't have to think about what you're doing. You just find the number and color it.
Thank you. Right. Afton.
Hi, everyone. I'm Afton Gardner. I work for KDHE. In my previous life, I was the health department administrator for Wallace County Health Department. And I live in Wallace County, Sharon Springs, out here on the Colorado border. My claim to fame is we're still on mountain time. There are 4 counties out here still on mountain time. I also kind of got thrown into this K-State life. My daughter is a biochem major at K-State and she marches in the band. She plays trombone. And so we are just so excited and happy for her. I'm obsessed with my camper. It's my camper. Like I have to always like when we were buying the camper, they would try to talk to my husband and my husband would be like, I don't know anything about campers. You got to talk to her. Like it is my camper. I take it by myself. The one at the bottom, we took it to Galveston one year for Christmas. My dogs, I call them my Aussie posse. I have mini Aussies. If you've ever had one, you get it. I'm obsessed with Halloween. I spend like all year planning our costumes. The kids, last year was the first time, not last year, the year before, when we were Alice in Wonderland creatures. That was the first time they've all participated. Otherwise, they all are like some odd thing, and it ruins my vibe. But yeah, a little bit about me, and I will be on camera soon.
Thank you.
I'm having technical difficulties, so I'm on my phone right now.
I understand. Not a problem. Right, Megan.
Sorry, I was trying to figure out how to unmute. Good morning, I'm Megan Gottschalk. I work for the Reno County Health Department. I've been here for about 10 years. I'm the Assistant Director for Community Health here. And in my previous life, I came from the not-for-profit world. I worked for the American Red Cross, so disaster services, all public health related. My favorite thing about public health really is about the prevention side of things and the community relationships and being able to make a difference in your community and across your state. So I think that's pretty amazing. Here you see on the screen, I've got 3 kiddos. They're pretty amazing and they keep me on my toes. 14, 10, and 9 now. She had a birthday last week. We love our golden doodle. And then that picture at the bottom is my work crew, kind of our education crew. We were dressing up for Halloween, which we also love around this place. We were all the minions. We were the aliens from the Minion movie. And I love gardening as well.
Yeah. All right, Christy.
Hi, I'm Christy Hanks. I work for the Elk County Health Department as a nurse. Things that bring me joy, spending time with my family and friends. We have a group that meets every morning at like 5 o'clock in the morning. We work out together, and that's some of the crew up there in the top. We're called the Wellness Warriors. And then my girls, which is my 2 half rat terrier, half chihuahuas that you see there, they're litter mates and they're quite the girls. That's Ziggy and Peanut. And then I also enjoy like traveling and camping. I go camping with friends and family. I like to read, do crafts and like sewing and quilting, and I like doing the diamond art and just any other DIYs type stuff. And then, of course, my church family. So,
Fantastic. Thank you, Christy. Jessica.
Hi, my name's Jessica. I have been at the Butler County Health Department for almost 5 years now. It'll be 5 years in June. I'm primarily their epi nurse, but right now I'm the only full-time nurse outside of WIC, so I'm doing all the things. I am also a K-Stater, so I'm super happy to see all the Wildcats on here. I have a dog named Oreo, and I'll probably also talk about my dad's dog, Mac, because they play together all the time and they're the best of friends. But Oreo's the one in the picture there. And I'm a huge nerd. I go to Comic-Con every year, get to meet all the celebrities and pretty much any nerdy things I probably know about. And I constantly have a book on me. So, yeah.
Thank you. All right, Mel.
Okay, hi, I'm Mel Huddleston, and I am a community health program manager at Johnson County Department of Health and Environment. I have been here since June, so fairly new to well, to the health department and public health. I also came from the nonprofit world. And so this is, although it was the healthcare nonprofit world, so very similar, but different. And so excited to learn a little bit more. I primarily manage our chronic disease prevention and injury prevention programming, but also was brought in to do some grant writing and fund development. So working on all that. And let's see. What brings me joy is being with my family. So I have 3 sons and I'm gaining a daughter in about a year. So my oldest just recently got engaged. My middle's a K-Stater and we're all K-Staters too. So that's fun. He'll be graduating in May and moving away. And my oldest lives down in Phoenix. And then my youngest is playing baseball in college in Iowa. So none of them are here anymore, but when we can get together, it's fun. And then my 2 fur babies are, this light just turned off. So Charlie and Lucy, they are the ones that love me now that my boys are all gone. And then I love gardening, so I can't wait for my flowers to start blooming again. Everything's starting to come up. So I'm excited to be here and can't wait to meet everybody.
Thank you. Rachel.
Okay. Okay, sorry. I apologize right now because I'm a terrible public speaker and I'm also I can't even say the word. I'm technology challenged. I'm Rachel and I've been here since September 2021 and I'm trying not to look at myself on the screen because that feels weird. But I've been a nurse for 10 an LPN for 10 years. I work at the Chase County Health Department, which is in the Flint Hills, like Cottonwood Falls, and the population here is about 2,500. So we're relatively small. With that being said, I'm usually the only one here in the office, so I do like the scheduling and the billing and the appointments and such. I like to, so when I'm not at work, I like to, spend time with family and friends and travel to see new places. I like to read. And when COVID started, I guess I became a writer. I started writing. And fortunately, someone wanted to publish me. But I haven't figured out the marketing side of things. But anyway, so I like creativity. I like coffee shops. My husband and I just became grandparents, so we're pretty excited about that. She's 4 months old, and her name's Maria. And yeah, I guess I would just say the thing I learned about, I think it applies to public health too, though. I mean, when I learned about writing is that you're never too old to try something new. So, yeah. And I like the part of public health with community and getting to know more people in the community and trying to think of, we're doing a thing right now. We just have a great leader. She just started a Pathways grant and we're working on a health improvement plan. So I'm excited about that. Thank you.
Thank you. Okay, Lori, you're up.
Good morning. Lori Lanter here. I am the mama of 4 boys. I've been with the Wyandotte County Health Department for 10 years in childcare licensing. Similar to several of you that have adult kids going off, I'm after having, that identity of being the mom of 4 boys and 2 of them being completely out of the house and one of them with his career he's a firefighter and then only one left in high school. It's kind of a strange feeling to have less to do and filling it with different things that aren't my children's activities. So I'm learning to have my own hobbies and things that I hadn't done for a very long time. So I do like to craft, but I'm more of a supplies hoarder than somebody who actually does the crafting because I just get the things with the inspiration that I will do something. So hopefully maybe we can add a little crafting in person since all of us are that. My K-State tie, it's funny, my oldest son and his wife both just graduated in December. So they were both K-State grads. And as it shows in my picture that I like to be outside, go camping. That's our modest little camper. And I'm starting a hammocking club, which that's hammocking. I just want to lay there and not necessarily read the book that I take with me, but have it and lay there. So, and then that was my team there at the health department on the right. So we do lots of things and try to get things done here. So thanks, guys.
Thank you. And sorry, my finger slipped. I did not
No,
mean to
that's
just
okay.
cut you off.
I'm done.
Amelia.
Hey, good morning. My name is Amelia Margent. I'm the Public Health Administrator for Coffee County. I've been a nurse for about 10 years, registered nurse for about 9. I am still fairly new to public health. I've been in public health for about 2 years now. What brings me joy? My family, gardening, baking, caring for animals, and traveling. We are actually currently traveling right now. So, yeah.
Thank you. Dante.
Good morning, all. My name is Dante Mallory. I am a billing clerk here at the Shawnee County Health Department. And a few things that bring me joy is my best friend and partner, Kaylina. Our 6 animals. We have 4 cats and 2 dogs, and they are definitely a handful, but full of love as well. And I'm also into, excuse me, all of the creative arts. I was a very big charcoal artist in high school, but now I'm moving more into fiber arts, and I'm working on crocheting right now. It started off as a hobby that um, was supposed to be just something that I just did on the side for fun, but now it's kind of taken over my life. So, um, outside of helping out at the health department and just doing what I can for my community, that's what usually brings me joy outside of that. So, thank you guys.
Thank you. Maria.
Hello, everyone. So, Maria O'Sullivan. I worked at Wyandotte County Public Health. I'm one of their public health nurse supervisors for EPI. I work alongside Miss Laurie, whichever box she's in. So what brings me joy? My family. I have 3 grown kids. So whenever they come by, because I'm also a homebody, whenever they come by, it's fun to have them all together in the house, which is rare. But I love board games. So no, I'm not crafty. I just buy the board games and just throw it there and be like, let's go play. Love doing 5Ks. I don't run. I just walk it or I volunteer it. And I do it mostly with my sister, who is the runner. And I'm like, you can run and I can stay behind because I am not running unless something is chasing me. Other than that, that's it. Thanks.
Thank you. Matthew.
Hi everyone, my name is Matthew Ubishazan, and I work as the Public Health Improvement Specialist at Sedgwick County Health Department. What brings me joy? My family, uh, Christmas period, and road trip. Thank you.
Thank you. Katie.
Hi, my name is Katie Pond. I'm the Health Operations Supervisor at Miami County Health Department. My family brings me joy. Those are my 2 kiddos. I have a 4-year-old and a 15-month-old. I love playing video games. It's actually how my husband and I met, and we still do it on the daily. And I love painting my nails. I do it every week.
Thank you. Sarah.
Hi. So I'm Sarah Porter, and I am the comms manager over at KDHE, the Bureau of Health, one of 2. And those are my 2 girls, Ellie and Piper, and then my older soulmate dog, Alba. I also have another one that we say we love him. Sometimes we don't like him. And then, yeah, reading, gardening, really, and my kids bring me joy.
Yep. Corey.
Hi, I'm Corey Powell. I work for the Saline County Health Department. I actually recently just got my CBS certification for breastfeeding specialist. So I am our DBE here in the WIC department. I actually just hit my 2 years here with Saline County on April 1st. So my joys are my family. My daughter is a competitive dancer for one of our local dance studios. So we are constantly on the go. They keep me on my toes, that's for sure. So spending the weekends out of town, my work, I put my pride and everything into this job. I work with so many moms and babies. And so I just love doing events for our health department and working as the president on our coalition here too. So just doing events and stuff bring me so much joy in my family.
Yeah. There we go. Hector.
Hello, my name is Hector Rivera. Can you hear me?
Yes.
Okay, because I've been having issues. So my name is Hector Rivera, and I'm a community health specialist and a community health worker for Finney County Health Department in Garden City, Kansas, in Southwest Kansas. And I am new to public health. I've been here since July of last year. The previous 15 years, I was director of religious education for St. Mary's Catholic Church here in Garden City. And I was in education before that for about 15 years. So I'm really excited. It's a very different thing for me, public health, but I'm looking forward to all the experience that it brings me. What brings me joy? Traveling. I love to travel. I like to go to new places and see new things. You can see I've been, my family is very important to me. I am not married, I don't have any kids, but I like getting together with my siblings, help my sister take care of my mother. Family reunions are really fun. Holidays are fun when we're together. And then I like, after getting all the kids excited and all sugared up, going back to a quiet home. And that's kind of cheating, but I like that. I like to travel. I'm very involved in my church. As you can see the picture in the middle, I took some youth to Rome. We went to the Vatican and explored that. That picture from SeaWorld was many years ago when they still allowed people to get in with animals. I'm talking at least 30 years ago. That's who I am.
Thank you. Monica.
I was hoping that wouldn't happen. No, I'm kidding. My name is Monica Scrutter. I have been a public health nurse for exactly 29 days. And so I'm quite out of my element, but I am at the Rush County Health Department and we are just starting over here. Things that bring me joy are my mom. I just recently moved back from Washington State after about 30 years, not in Kansas, and have moved in with my mom, which is quite a thing at my age right now. So it's interesting to have to ask permission for things. Anyway, rules the roost. And my grandkids who are all up still in Washington State, but yeah, so I also love to travel. I recently joined a travel group and I've been to Cabo, which is the picture. It was amazing. And hopefully a few more trips coming up as we go forward. I have one of my friends is taking me on a Panama cruise for 3 weeks in September. So I'm excited for that. I think I'll need the break. But anyway, I'm really excited about this course to learn about the public health and how I can impact. I'm excited about the prevention piece of it and improving the community that way. I actually graduated from Fort Hays State, so I am a minority in the K-State company, but I'll cheer for you guys anyway. Thanks.
Thank you. I just wanted to point out we do have one other person, Jamie Tyson. She is not able to be with us today, so I just threw up a slide to let you know that we have one other person. We'll get to know her in May, but she couldn't join us today. So All right. Do you know how hard it was for me after every person to not make some comment and try to find that connection? Because I loved getting to know all of you. I found so many connections there. So thank you for sharing. We were trying to go through it fast, but that was very, very hard for me to just move on to the next person. So thank you for going through so quickly. We look forward to getting to know you more as we go through this. So I'm going to go through these really quickly. We're going to make up some time here. Like I said, we will have time that you can ask questions, you can get to know this better. We'll have resources dropped in there, but we're just going to give a super quick overview of what we're even talking about when we say foundations of public health. Because that is, I mean, that's the title of the program, Foundations of Public Health. It is based on the Model Foundational Public Health Services. So let's ground ourselves on what we mean when we say that. So I just want to point out first that this program was developed as part of the Public Health Infrastructure Grant from KDHE, and that has three components: workforce development, supporting the foundational public health services, and data modernization. So of course, it's obvious that we are addressing the foundational public health services in this course, but we're also addressing workforce development. So those are our two tie-ins to that grant that this program is being funded through. All right, just a basis of what the Foundational Public Health Services is. It's meant to define a minimum package of the public health capabilities and programs, specifically for governmental public health. So for the local health departments, especially those who are serving the community. We know that health departments have a responsibility to provide public health services and protections to the communities they serve. They also require a wide range of resources to serve those communities. And so this infrastructure that you're going to see, the Foundational Public Health Services, it's that basis for what's needed to fulfill those responsibilities. Yes, thank you. And Sonia dropped in a fact sheet that's on our resources page that will dive into this a little bit more. This is what that foundational public health services model or framework looks like. So just to break it down a little bit, up at the top, you'll see we have the foundational areas. These are going to be the areas of expertise or program-specific activities that the governmental public health entities work in. And then you have the foundational capabilities at the bottom. These are going to be the cross-cutting skills and capacities that are needed to support those foundational areas. In addition, I do want to point out that down at the bottom of the framework, you can see the word equity. This is to signify that equity is the role, equity has a role as the foundational principle. That's going to underpin and support all of our public health efforts. As we said before, public health exists to serve all individuals. So a key part of our work is ensuring that everyone has the opportunity to achieve their best health. Because this is the base of our framework, we'll explore the basics of health equity a little bit later today, and we're also going to be diving a little bit deeper into it next session. We wanted to ground it with us today as that basis. All right, so again, the foundational areas, these are probably familiar to many of you. Because they're the topic of specific public health programs and services that the local health departments provide, aimed at improving the health of the community. So addressing communicable diseases, chronic disease and injury, environmental public health, maternal child health, and access and linkage to clinical care. So these are going to be the programs and services that you see every day. Where we're basing most of this class is in the foundational capabilities. So again, like I said, these are the skills and capacities to support those basic health protections, programs, and activities. And you can see on the screen what those 8 capabilities are. And we're going to look at each of them individually here in just a minute to give a little more definition of what each of those means. So I won't read those off right now. So why does the Foundational Public Health Services framework exist? And why are we basing it on this class? So the main reasons for this model are to provide a common language and narrative for what those governmental public health services are, pursue sustainable funding for public health infrastructure, and set a foundation for what's needed everywhere for public health to function anywhere. It helps us promote and protect the health of populations. It's a framework to guide our transformation and modernization efforts. Helps collect information on capacity and cost, and then it's also embedded in the Public Health Accreditation Board standards and measures. And again, this is super quick, but public health in general, it just loves frameworks and models. So you've probably heard of other frameworks for public health programs. I just want to align us to how these do all fit together. So the essential public health services, this is the one that I studied more. I remember studying it more when I was in my MPH program. And the essential public health services, these are really the overarching public health system at large. Then you get into a little bit deeper. The foundational public health services gets more specific to governmental public health. So again, that's why we're focusing the content of this class on those foundational public health services, because they really are guided towards that governmental public health sector. And then you also have in the middle there the Public Health Accreditation Board standards. If you have a health department that is trying to work on accreditation, these models are where they're going to base some of those standards for that. So again, super quick. I feel like I'm trying to fly through them. So sorry if I'm talking really quickly.
We have time.
All right, so let's dive a little bit deeper into the foundational public health services, because again, that is where we're going to base most of our content. So just an overview, we'll talk about this more when we get into the course overview, but each of our sessions is going to focus mainly on one of these capabilities. So today we're just kicking off. We'll do a little bit on equity, but for example, next month, we're going to look closer at the equity capability and the organizational competencies capabilities. There'll be a little bit of shuffling around, and we'll talk about that more when we look at the calendar, but that's kind of how we base this, is each session we're really going to focus on one thing. So let's dive into what each of those are. The first one is accountability and performance management. So this one's about making sure that the way we perform our responsibilities meet all the standards, laws, and policies. Ensuring that there's a performance management system in place and that we maintain that system when we're doing the work that we do. When we're lifting up programs and practices, we want to make sure that they're evidence-based or that they're promising practices. And finally, it means having a culture of quality and quality improvement. Assessment and surveillance has a big component associated with data. So that's going to talk about collecting, assessing, analyzing, and using data. It also involves paying attention to gaps and inequities in the diseases and how they affect communities, as well as the social determinants of health, which really means the way that our health is affected by how and where we're born, grow up, and live our lives. And we'll look at that more in just a little bit. Taking data and turning it into understandable messages and reports, conducting collaborative community health assessments, rapid detection through laboratory services or surveillance systems, and working in partnership with the community to collect, report, and use public health data. These are all components that feed into that assessment and surveillance part. The next one is community partnership development, and this includes developing relationships with our partners, creating and sustaining those relationships in our communities, and then relying on those partnerships to create solutions that are grounded in equity and have a goal towards increased health equity. Trust is a significant element of this capability, and that's all about being authentic in the way that we interact, particularly with people and members of the community who are most impacted by the disparities. This capability also includes connecting across government agencies at any level of government and tapping partners for the community health improvement plans. You'll notice as we talk that many of the capabilities intersect. So I want to point out that communications is its own capability, but it also tends to run through part of everything that we do. Nearly every capability does include something to do with communications. For the specifics communication capability, though, we're looking at some things like relationships with the media, being able to write press releases, do press conferences, those kind of things. Using social media effectively, making sure communications are tailored to specific audiences, putting together a routine communications plan, and having a risk communication strategy. Being ready around the clock to address communication needs and having a strategy for health education are all really important, and again, tie into all of those other capabilities that we'll be looking at. The emergency preparedness and response capability includes having strategies and plans, developing and maintaining all of those response strategies and plans. And it's also about incorporating social determinants of health, making sure that they're addressed and incorporated into those plans as we're making them. Assessing and coordinating the scope and responsibility for public health response is also a big part of this particular capability. And another piece is activating emergency response personnel and the communication systems. It also includes the ability to maintain a continuity of operations plan and making sure that the community is ready and prepared. In the event of an emergency, it involves issuing and enforcing emergency health orders, but also at any time being ready to learn about and respond to emergencies. The next capability is equity. Remember that the revisions we talked about in the framework ensured that the entire model was going to be equity-centered. That's where you see that equity down at the bottom of the whole image of the framework. So with this change, again, you're going to see equity-related activities sprinkled throughout all of the areas and capabilities. It's a thread that runs through everything, but it's also its standalone capability. So while many activities will drive us towards a higher level of health equity, there are also activities that are significant enough to be called out in this capability alone. Beyond incorporating the social determinants of health, we should also be working strategically to address them. So things like thinking upstream from diseases, conditions, and behaviors that present themselves every day. Folding equity into how we measure and prioritize the foundational responsibilities. Being intentional about a shared understanding of equity for our communities. And making sure that the people who are doing public health at the local and state level can and know how to address health equity. Through partnerships, we want to work to create a shared understanding with our community partners and with our communities about what creates health and what produces those inequities so that we can address those more effectively. Organizational competencies is a big capability that actually has a bunch of subgroups. They might look at a first glance like they're not connected. However, if we think about organizational competencies as the components that keep the public health system rolling, we can see that all of these subgroups do work together in the background of everything we do. So we have leadership and governance. This is about providing leadership through the agency and community, being the face of public health, making sure that equity and inclusion are built into the agency, engaging with legal authorities, and making sure that the public health boards and councils have a diversity in their representation. We have information technology services. That involves things like maintaining hardware, software, and communication technologies, as well as confidentiality and security. Workforce development looks to make sure our workforce is diverse, but addresses basic human resource functions like retention, training, and performance review. Financial management is making sure there's a financial system that includes budgeting, auditing, billing, and that we have the ability to secure grants and other funding. This does also include the maintaining of facilities and operations and making sure there are resources geared and directed toward equity. And then finally, this capability includes access and appropriate use of legal services. The final capability that we'll look at is policy development and support. This involves public health professionals being comfortable and confident in being the subject matter expert when it comes to policies related to health. Researching, analyzing, costing out, and sharing what impact might be. It also involves bringing a public health lens to other types of policies. This is often called a health in all policies approach. We, of course, often have a responsibility for compliance and regulation of policies, and this capability also includes making sure that we're building equity into all of our policies. All right, let me see where I'm at on time. So we have a few more minutes. I've got a game for us to play, and I wanted to make sure we have time, and I think we do. It'll just go a little bit faster. So I went through those incredibly fast. I know that. We don't expect you to be an expert coming out of that, or even at the end of this course in all of those foundational capabilities. But that did give you just a quick overview of what the capabilities are. And hopefully now you can see how some of the duties that you might do in the health department can relate to those capabilities. So if you will pull up on your screen, and here, I'll drop a actual link into the chat as well. You can go directly to this, use the QR code, or go to menti.com and pull up that code. We're going to play a quick game. I do have a prize too that you'll get at our in-person session next month for the person who wins. But let's go through this real quick and see how you can apply some of those capabilities. So while you're getting on, I'll change over what I'm sharing here. I cannot see how many are on, so I'm going to give you just a minute. Let me know if you're... Yeah, sorry, Sonia. This is for everybody else.
You guys are able to click on that link and or find the QR code? Can I get a little thumbs up? We're logging in. Yep. All right. We got a few.
Cool.
This is play by choice, but playing is fun.
Yeah. Okay, keep putting thumbs up when you get it, so I make sure I've got the majority of people at least. Okay, does anybody need a little more time to hop on? Okay. All right, let's play Foundational Feud. So for everything that we go through, I'm going to give you a scenario, and you're going to tell me which of the capabilities you think it falls under. I'm going to let you know that this is time-based. So you get points for being right, but you also get points for being fast. So you have to decide if you're going to think it through or if you're just going to click on what your first instinct is. That's how you get more points. So let's go. Let's get ready to start. All right, our first. Ready? Providing data on the percent of children who have all required vaccinations. Which of the capabilities does that fall under? Awesome. Most of you got that right. Assessment and surveillance. Let's see who was fastest. Ooh. Do you know who Ambrielle is? Because I think it named you. Okay, we'll see at the end who's actually... Look at what your name is when we get to the end here. Okay, ready? Conducting research and providing recommendations for staff raises or salary adjustments. Great job. Most of you got it. It's organizational competencies. That's that weird one that has several subgroups in it. But I can also see where everybody else got their answers because, again, all the capabilities are a little bit intertwined. All right, who was fastest on this one? Ambrielle is still the fastest. We're going to have to figure out who that is then. Sarah thinks it might be her. Participating in a drill with community partners about a severe weather event that affects your community. Woohoo! Everybody got that one. Good job. That one was emergency preparedness and response. Hey, Ambrielle, Amelia is trying to catch up with you. We got 4 more questions to get through. 5 more. Collaborating with city planning committees to advocate for zoning regulations that prioritize walkable neighborhoods. Policy development and support. Great job. But again, I can see where the other ones fit in. Okay, somebody's got to come for Ambrielle because they have not moved out of that top spot yet.
Yeah, but cake is close.
They are very close. Leading a community forum to collaboratively develop a community health improvement plan addressing significant or identified priorities. Community partnership development. Good job. Majority of you are getting all of these right. See, I could have spent less time on those foundational capabilities because I think you guys know them. Uh-oh. Oh, we had a big overturn there. Love site. Okay, let's see if they can come back. Attending a workshop looking at the intersection of race, ethnicity, and health disparities. Equity, good job. And where did that put the leaderboard? All right, love side is still in the top. 2 more questions. Let's see. Anybody's game still. Leading regular quality improvement meetings to review performance data and identify areas for enhancement. Accountability and performance management. Good job. Right, love site. You're still in the lead, but we have 1 more question. Tailoring a presentation on childhood vaccinations to a diverse audience with varying levels of health literacy. Communications. Good job. Great. See who we got as the winner.
Ooh, big shift.
Ooh. Oh, Grace, you just pulled out ahead at the end. Who is Grace? I'm gonna go on because it's can you guys hear the music in the background too, or is that just on my computer? Okay, good, because it's kind of annoying.
Emily, I think I was Grace.
You were Grace, Sarah?
Yeah.
All right. Well, great job. Good job,
Thanks.
everybody. Like I said, we went through that super quick on those capabilities. So I'm really impressed with how many of you got the right answer, even though I went through each one in like 1 minute. So we will cover all of them in more depth, but that was just a really quick overview of what each of those capabilities are and what we're going to be basing this program on. So because we just threw a whole bunch of stuff at you and we have more stuff following this, we're going to let you take a break now. Sonia, how long are we giving them?
Yeah, let's go ahead and take a 15-minute break.
Okay.
It's important to get away from the screen. We're going to hold here for 3.5 hours. We're going to go take 2 breaks today, 15 minutes now. So see y'all in
Perfect.
15.
Yep, at 9, what would that be? 53.
Do. So an introduction to health equity. And I'm just going to tell you, we could spend the next 8 months working on just this topic. And I can say the same thing about every other topic we're going to do in this course. I mean, people get graduate degrees in every single area of these capabilities. So if it feels like we're skimming along, there's some truth to that. Also, we're all bringing different ideas about health equity and our understanding of it because of some people here have 10 or 15 years of experience. Some people have less than a month. So we're all coming at this from a different perspective, but we've also all been walking around. So we have some ideas. You have expertise that you're bringing. And I just want to invite anybody who wants to answer, when you hear this idea, health equity, are there some ideas that are first thoughts that come to your mind? And you can message them in the chat or you can unmute. Like when you hear for health equity, what comes to mind?
For me, I always think about that little picture that you see in a lot of like health books where it's like the one person is looking up, well, 3 people are looking over the fence and one can't see, but the other one's like only one can. And then if you give them all of the same box, 2 of them still can't see. But then if you make it to where they all can see over the fence, it's like, kind of like explains a
Awesome.
little bit.
Yes, Lakia, we've got a similar picture in this slide deck. So yes, love it, love it. That's exactly what I think of. Isn't it awesome that many of us, like, imagery helps, right? Because this is kind of an abstract idea. All right, I love this. This is a lot of people thinking about this. Yeah, making healthcare available to everybody when they need it. All right. So we're going to think about this is we're gonna I feel like I'm gonna have to talk fast. This is what the actual capabilities for health equity are in that document that we linked to you earlier. And I don't think we can get to proficiency in 3 hours, but we do hope to introduce you to resources and ideas that are core to public health and some resources that might be new to you. We hope to connect you to the greater understanding of the public health system in Kansas and in the US, and to underscore that to achieve health equity, we must make more progress on diversity, equity, and inclusion efforts across the system. So we're looking at social and structural determinants of health. We are looking at the ways to support staff development in this area. And we're looking at creating a shared understanding of what makes health, including the structural and systemic factors. We are definitely going to do a deeper dive into that last one at our next session, where we're going to spend some significant time thinking about these ideas. All right. So I have a quick question for you all. This is what influences your health? What helps you and what holds you back? So, and I'm going to ask you to have a small group conversation about that. So we're going to pop you into breakout rooms, and I'm just going to open those rooms in just a second. So here's the question that you're going to go talk about. I'm going to give you about 4 minutes to talk with your colleagues about what influences your health, what helps you, and what holds you back. There's no right or wrong answer to this. Just inviting you to think about your own health experiences, what helps and what holds you back. And you'll just accept that room invitation, and you'll have names on each other's screens. If you can, camera on in your small group, great. I'll see you back in about 4 minutes. This will move fast. Welcome back. Everyone will be back in 3 seconds. If you want to share some of the things that help you or hold you back in the chat, I love to see those. So awesome. Thanks, Hunter. You're going to do a lot of that when we do these virtual sessions. So that's great to see. Breakout groups are helpful. If anybody wants to share some of those kind of bigger ideas of what helps you and holds you back, I promise it's for a purpose. Hey, Lori. Yes, the built environment. I love the fact that my neighborhood has sidewalks that are just a little bit wider than the old traditional sidewalks. It makes it so much easier to walk next to my husband while we walk. I love that. You talked, Hunter, you guys talked about cost and time and environment and culture and resources in the community. Yes, all of those things. Prioritizing, yes. I'm still just like blown away by, I got to go back to find the name because I wrote it down, 5 a.m. Christy, 5 a.m. Wellness Warriors. I mean, holy cow. But I bet the idea that someone's waiting for you is pushing you to get to the place. Like they're going to be waiting on you.
Yeah, and we have actually a personal trainer that does this for free for us every day. And there's anywhere from 5 to 20 of us.
Wow. So there's a
Yeah.
system in place. There's a structure. There are things that are helping you out. Yeah. I mean, I think about things that hold me back, like when my husband does the grocery shopping, and mostly he's just awesome at it. And every now and then he comes home with Oreos, and I will eat the whole bag, like over the course of a couple of days, but seriously, the whole bag in a couple of days. So, there is a system and a structure that helps us, and we're all experiencing it. All right. I love all these comments that are coming in there. We do have systems and structures that help us. All right. So this is a big title, social ecological model, but it basically reinforces the notion that you're all describing in yourselves. Like sometimes you just have to have willpower and choice. Like individually, I'm making some decisions in my life, but a lot of my decisions are influenced by the relationships that I have, my family life, my friends, my culture, the relationships I have with my work environment and those kinds of things. And then the community that's around us. How is our community influencing um, all of our choices and our opportunities to be healthy? And do we have access to a grocery store with the fruits and vegetables that we need? Can we get to the primary care provider? And then societal influences, like our society has a lot of influence on the physical activity and health behaviors we all appreciate. And like oftentimes I use another version of this where society and policy are in the same loop. Some of the policies that we have also help us and hold us back. And again, we could do this for a long time, but there are structures in our system that help us and hold us back. And that's the thing that I wanted to reinforce here. All right. So here's a definition for health equity. For the purpose of today, we're going to be using a definition of health equity that says health equity is the state in which everyone has a fair and just opportunity to attain their highest level of health. And achieving this requires focused and ongoing societal efforts to address historical and contemporary injustices. We have to overcome some economic, social, and other obstacles to health and healthcare and eliminate preventable health disparities. That's what we're trying to do. This is what we mean when we say health equity. There are some at this point that I think could just say public health is about creating a system in which everyone has a fair and just opportunity. This is like, as you saw in the model, the FPHS model, the Foundational Public Health Services model, health equity is one of the capabilities, and it's also surrounding the whole thing. So the definition includes this notion of health disparities. And when we say disparities, we're talking about those preventable differences in the burden of disease, injury, violence, and opportunities. So there are differences in health outcomes that occur, and it's hard to understand why they happen. So one of the things that has been interesting, how many of you went to the Governor's Public Health Conference? Few of you? I was not, when I looked at the agenda for the Governor's Public Health Conference, I can honestly say I was not really looking forward to the keynote that was going to talk about sudden unexplained infant deaths. And he was amazing. That guy was really powerful, and he illustrated time and again that there are systemic structural things that are happening that are influencing these outcomes, and they're not the same for everyone. There are disparities in these outcomes. Another health issue that is troubling to me, there are several people from Sedgwick County here. I worked in Sedgwick County for most of my career. The infant mortality rate for Black babies is 3 times the rate of white babies in that county. And that's not unusual. That's true for many places. The maternal mortality rate is much higher among African American women than it is among white women, even if you factor in a college-educated, higher socioeconomic status African American woman is at greater risk than a high school educated white woman. There are just disparities in outcomes, and there are reasons that those exist, and we need to continue to work like public health. If our work is to try to reduce health disparities, we've got to know the data and work on them. Several of you mentioned this graphic or a graphic like it. I like this one because everyone should be able to have access to a tree. I love that baseball game analogy, but as a person who regularly pays to attend baseball games, I'm not sure we're all getting to see a game for free. So I like this graphic. Like getting the same opportunity does not mean that it's fair and equitable. So we're getting that idea. And several of you mentioned also this equality versus equity bike image. So when we think about closing health gaps, it's not just about offering everyone the same opportunities. Instead, it's recognizing what resources do they need? What resources do each of us need? We're going to do a quick poll. And this is our poll question. And thank you. There's a quick poll on this screen. What has the largest impact on your health? Is it socioeconomic factors, physical environment, your own health behaviors, or health care? Getting access to health care. All right, we've got 18 of 22 votes in, and we're not voting, so I'm going to go ahead and end that poll and share the results. So here's what the groups thought. Mostly health behaviors, tobacco use, physical activity, nutrition, alcohol, and that is a huge influencer of our health. And about the next best answer from the group was the largest impact on your health was socioeconomic factors. All right, well, let's take a look and see what the research says. The research says that you're really close. You're really close. It is about our health behaviors, but we are even more influenced by our socioeconomic status. Those social determinants of health, our education, job status, family support, income, community support, is attributed to roughly 40% of our health outcomes. And this research has been done and redone and published many times. So, and referenced by many national models. So this is not just like, I didn't just go grab this off of TikTok. This is real research. So let's talk about what are those social determinants of health. And this is a graphic from the American Hospital Association that has done a lot of work in the CHNA kind of work, the community health needs assessments, and trying to understand what do our communities need. And again, it's thinking about economic stability. If you're broke and you're in debt, and I've been there, you're not like making your healthiest choices. You're not even thinking about healthiest choices. You're just trying to figure out how do we pay the bills. If your neighborhood and physical environment is less safe, you're less likely to get out and walk. And walking is one of the best physical activities that many people can do. Education. Many of you identified that being outside was just also good for your mental health. So neighborhood safety is important. Our education is important. Our access to food is important. Our having healthcare providers and being able to get into a healthcare provider and then having a healthcare provider who's high quality, those are also influencers. But those social determinants of health are those items that we talked about here. Healthcare access, neighborhood and community and built environment, social and community context, economic stability, and access to education and quality education. And these 5 social determinants of health are described by Healthy People 2030. Healthy People's been around since 1990. It sets objectives for public health and for health outcomes nationwide. And it's a great resource if you've never looked at Healthy People 2030. It's not just about social determinants of health. If you're trying to figure out a good population level metric for basically anything under the sun, you can probably find a good one in Healthy People 2030. But it specifically is calling out these social determinants of health. Oh, thanks, Emily, for dropping that in. Okay, so here's what I'm going to do right now. I am going to speed through the 5 social determinants of health and give you an example for each one. It's not nearly enough. We could do 25 examples for each one. But when we think about healthcare access, I love this quote. Of all forms of inequality and injustice in healthcare injustice in healthcare is the most shocking and inhumane. So when we have unjust access to healthcare, Martin Luther King called that the most shocking and inhumane form of inequality in our system. So who doesn't have access to healthcare? And these are just a couple of quick graphics. There's no quiz on this. I just wanted to give you some illustrations. And these data are from the Kansas Health Institute's analysis of census data. Let's look on the left-hand side. Most uninsured Kansans are non-Hispanic whites. So most people who are uninsured in our state, 53% of them are white. Among Hispanic Kansans of any race, 24% of Hispanic Kansans are likely to be uninsured. Among all Kansans, 9% are likely to be uninsured. Among whites, 6%, almost 7% are uninsured. There are many uninsured adults. We have 15% of Black non-Hispanic adults are uninsured. Insurance is a gateway to health access, as we all know. And many people believe that because of things that have happened in the system that everyone has access to health insurance. And the truth is there are many people who still do not have access to health insurance. And when you don't have access to health insurance, it's very hard to get access to care. It's going to be fun when we have opportunities to talk amongst ourselves. Most of you are from local health departments. I think we have one KDHE person and one FQHC person. And FQHCs are another way we try to get access to KDHE. And one way to get access to care is through FQHCs. All right, now we're going to talk about neighborhood and built environment. And here's one measure that is from Healthy People 2030. That one of the things that we want to do is reduce the proportion of families that spend more than 30% of their income on housing. And that number's going the wrong direction. Right now, among 15 to 24-year-olds, we find in Kansas that 53%, this is the percent of renters spending more than 30%. So 53% of renters in Kansas who are at 24 and younger are spending more than 30% of their income on rent. Why does this matter? It matters because if you're spending that much more on rent, if you're spending more than a third of your income on rent, then you don't have the funds to do other things. And like taking care of your healthiest choices. So this is a public health measure, is how much people are spending on their rent. Social and community context. Within this, we talk about access to healthy food. One of the goals of Healthy People 2030 is eliminating very low food security in children. That's one of the measures. And so this is from Feeding America. And we can pull up these graphics every year. There's an update. And in this graphic, you can see that 13% of children in Kansas are food insecure. That's almost 100,000 kids. And there are counties like Stanton, Chautauqua, Montgomery, Wyandotte, and Geary that are the highest in food insecurity or low food security. And if you want to know how this is defined, because you're a data nerd and you love all of that kind of stuff, I can send you some resources. But we're looking at some counties where we have as many as 35% of kids food insecure. And if we wanted to look at this another way, we could look at free and reduced lunch. When I started working in public health, 3 out of 4 kids in my county, which was Sedgwick County, were on free and reduced lunch. So it's about 75%. Now it's over 80% of the kids are on free and reduced lunch. So we've got a lot of economic instability that's influencing access to health in a lot of different ways. The last one the second to last one we're looking at is reducing the proportion of people living in poverty. We know from those social determinants of health that poverty is an influencer of poor health. And in Kansas, 23% of Black or African American residents are experiencing poverty, not 200% of poverty or 83% or whatever those breakdowns are for WIC and other programs, but actual poverty. And this is a lot of people living in very low income experiences. Last but not least, we need high education access and quality. And I just wanted to look at some reading and math scores. We're not doing very well nationwide. I was thinking about this recently because my husband's retired, so we also travel. And we went to Costa Rica at the end of March. And in Costa Rica, as a country, they have a 97% literacy rate. The literacy rate among adults in the US is 79%. And we're falling behind at 4th and 8th grade levels. And if we know our population that we're serving is lower literacy, you guys know, if they can't understand the thing that we're trying to explain, if they can't read the instructions, if they're struggling to figure out how to solve basic. Thanks, Afton. I was looking at when they said what their literacy rate was. I was like, can I find the exact same source to compare to the US? So it's like, this is important. And we know that people who are lower education are more likely to be smokers. So if I look at behavioral risk factor surveillance data among smokers, and I mentioned several of you mentioned chronic disease responsibilities. I think the smoking rate among high school or less is about 30%, and the smoking rate among people with college educations among adults is less than 6%. So we know that education and income influences health behaviors, and we want healthier public. All right, we need data to help us. We also need to understand what the public health responsibilities are. So what we do. What do we expect of the public health workforce as it relates to all of these things? There are a set of core competencies related to health equity. The core competencies are organized by the Council on Linkages between Academia and Public Health Practice, Again, I do like whole hour workshops on this concept, and I'll do one actually this afternoon. This is something that the core competencies are foundation for how do we know what we're supposed to do in public health. And they've been around for a long time and they've been revised. They first got published in 1991 as a set of universal competencies, and then they started calling them the core competencies in 2001. So they've been around for a while. The most recent set is from 2021, and it is a consensus set of skills for the broad practice of public health. So if you're coming to public health from some other world, like healthcare, or some other angle, nonprofit world, how do we know what we're supposed to do in public health? These consensus set of competencies tell us the answer to that. And they're organized into 8 domains. And you can see those 8 domains here. I'm focusing right now on just the one. There's a whole domain for health equity skills. Not only that, a couple of years ago, like 3 years ago now, there was a new set of competencies just focused on health equity, but called racial justice competencies. And this set of racial justice competencies for public health is another 17 competencies organized into assessment, policy development, and assurance. And as a way for us to think about what are these competencies and what do they have to do with health, we're going to do a little poll. So I'm going to invite you to participate in this poll. You don't need this on the screen. I'm going to give it to you another way. So hold, please. I'm going to copy this. All right. This will be easiest if you do this on your computer. So I just dropped a link in the chat. I also will give you a QR code if you'd rather do this. This is an easy poll, so you can do it from your phone if you want. This is not going to be hard. You can do it from your phone if you want. We're going to answer 9 questions on a poll. It's not timed. And when you log in, it's going to ask you your name. Just skip it. I'm not pulling a report from this. We're just using this as a device to consider some of the ideas. And to practice with the polling software, we're going to talk about the best Easter season candy. And I know there are other options out there, but it's a short poll and we're just practicing. Also, I just wanted to see if people were able to get into the polling software. All right, I see. Emily, I agree 100%. Cadbury cream eggs are disgusting, but bless you, 42% of you who disagree with me. I love that. That's just fine. I like jelly beans, but I really only like the Starburst ones. Beyond that, it's just weird gumminess. I actually feel sad eating chocolate bunnies. I know they're traditional, but I'm like, it's a bunny. Why would you want to eat it? Okay, thank you for playing our game. We've got 20 people who are playing our game. All right, here's what we're going to do now. We're going to look at, this is less exciting, but this is on to the content. 7 quick questions. I want you to just think about your proficiency with the health equity competencies, and we're going to look at a short list of these. Oh, bless you, Jessica. All right, so we're looking at 1, engages in continuous self-reflection about your own biases. So when I look at this competency, I think, how often do I reflect? What are some tangible ways that I could be reflecting about my own biases? And there are some really fun assessments that you can do on this. Harvard has an implicit bias test that you can do. And if you've never done that implicit bias test, it's really interesting. And they have an implicit bias test. It's not just about race and ethnicity kinds of things, but also like body image and gender. There are lots of different kinds of ways that we can demonstrate biases. All right. So most of you are aware, but nobody's saying, oh, I've nailed this. Like I'm totally proficient in recognizing my own biases because who is my musical lover? Avenue Q, Everyone's a Little Bit Racist is one of the songs. I mean, we all have some ways to explore and understand what biases might be influencing our thinking and how we're doing our work. All right, next question. Another one of the health equity competencies is that we will reduce systemic and structural barriers that perpetuate health inequities. There are 7 competencies in the core competencies around health equity, and I think this is the hardest one. That as a public health system and as a professional, my job is to help reduce the systemic and structural barriers that perpetuate health inequities. So first of all, I have to know what they are. And second of all, I have to work on systems work to change inequities. All right. Like I know what that is, but I'm certainly not proficient in being able to do that work. And this is what the set of standards says as part of our work as public health professionals. Here's another health equity competency, advocating for health equity and social and environmental justice. And I have to tell you right now, I'm feeling a little held back from being able to be a strong advocate for this. I was in a meeting yesterday where I was told that we had to change an entire training to not include the words health equity because the funder won't allow it. And I'm still kind of wrestling with what to do with that information. So how confident or how proficient do we think we are at advocating for health equity and for social and environmental justice? To be honest, I would have to go do some reading to understand what it means to have environmental justice. I've worked with some health departments recently that had environmental justice grants, and I was like, ooh, that's cool. I wonder what that is. Like there are so many avenues and areas here. Yeah, Rachel, great question. If we have time, I'll tell you the answer. All right, next one. This is the last one we're going to look at from the core competencies. This is another health equity competency, implements organizational policies, programs, and services to achieve health equity and social and environmental justice. This is another one of those times where I think this is really challenging because what would be a program or service that would help us achieve health equity and social and environmental justice? And I think one of them that almost every health department in Kansas has is WIC. I think WIC at its core is working to reduce disparities in income, to reduce disparities in health outcomes. I think through the education that's happening there, that's just all of that is like, it's all good stuff. The Healthy Babies program at Sedgwick County Health Department, and many health departments have one of those. If I won the lottery, I'd fund that for every mom. I just think that everyone needs someone to walk alongside them and help them figure it out. All right, thanks for thinking about your own proficiency with this. We're going to look at 3 more, but these come from the racial justice competencies. So the racial justice competencies are 17 across 3 tiers. They have 51, which I think is a lot. But the racial justice competency, this one is create opportunities for individuals and organizations within a community, including non-traditional and unconventional partners, to collaborate to improve health. I think one of the things that happens in public health is we go back to our same partners over and over again. Like my buddy at the hospital and my buddy at the United Way and somebody at K-State Research and Extension who lives in my town, and that's our committee. Even when we organized this course, it was mostly my friends and neighbors in public health, and we had to really start thinking like, how do we stretch a little harder to work on non-traditional and unconventional partners? All right, 2 more. I'm competency, implement health equity and racial justice principles by teaching and mentoring our peers on self-awareness and reflection, empathy, and interpersonal dynamics. I'm 54. I used to be the director of the Center for Public Health Initiatives where I work part-time. I find it hard to mentor my peers, and I shouldn't have anything holding me back. But I will see people do things and I think, man, should I say something to them and offer a little nudge of mentoring support? And then I think, who am I to do that? This idea that it's a competency that we need to mentor our peers so that we can be working on our interpersonal dynamics within the context of health equity, I think is really asking a lot and necessary. I'm not saying we get to let ourselves off the hook. I'm saying that like doing this work well is really challenging. Like last one, Rating your proficiency on organized conversations with community. So first of all, you got to do that with the governing body, like your elected officials, and talk to them about policies, programs, and services that could address inequities and strengthen the community. I think one of our core things that we're trying to accomplish in this series of workshops is to just flesh out, what does it mean to do this work well? What might some of the components be? Are there some nuances that you can come to today with all of the experience that you're bringing today that might help you consider new ways to approach this work? If you want to look more at these competencies and play more in this space, there's resources in the folder. I can also send you additional resources, but today was just an opportunity to begin to think about what would it mean to actually do health equity from a core competency perspective and within this context. All right. We are done with that section, and I'm passing the baton back to Emily for course orientation. I think I'll stop share so you can reshare.
Sounds good. All right. I want to open it up first. Does anybody have any questions or comments on the health equity? There was some good discussion in the chat while we were going, but I do want to open it up, and especially like Sonia said, this is, I mean, there's hard times, and it's kind of scary in public health. I don't know how you do public health without health equity, so thinking that through. So I want to give the space if anybody has anything they want to say before we jump into course expectations. Okay. Know that we appreciate all the work you do at the local level, and if there's anything we can do to support you, we're navigating through it too. But we also want to be a space that you can talk and get some support too. So, all right, I'm going to go over to course orientation. This will kind of guide us through what we're going to do for the next 8 months and some expectations, and then we're going to develop some group norms together. I'm going to share my screen here in a minute, but this is a link to the participant handbook. And instead of going back to the slides, I'm going to pull this up and we'll just look at some things together, not reading through it, but just going through kind of what we expect, what you can expect from us, and where you can find that information. So let me get the right screen shared here. All right. So I dropped the link into the chat. You can find this on your resource page. We update it if there's any updates that need to be made, but mostly this is what you'll be able to expect throughout the year. We already talked about the capabilities that this course is built off of, and we'll look at the calendar here in a minute to see what we'll be looking at each month specifically and kind of the structure of that. You have both of our email addresses. You can reach out anytime. Send us an email. If you have anything you want to discuss, we're also always happy to look at our calendars and jump on a Zoom meeting with you, have a phone call. We can chat about anything you might be having some concerns with. I know in my email signature, I've got a book a meeting with me link. You can use that to pick a time that works best for you. Sonia is a paper planner person, but she's also available. So either of us are happy to have that time with you. All right. These are some course policies and expectations that we have. The biggest one is active participation. So this is really, we've got the content, we've got the speakers, but we really want to make sure that we're tailoring this to you and making sure that this is an experience where you're also getting that networking with your peer participants. So active participation is one of our expectations. We're going to talk about some group norms for that, but some of our things that constitute active participation are attendance for the scheduled sessions. Now, I know a few of you have reached out to me to sessions that you can't make it to, and we completely understand that. You have personal lives, you have work responsibilities. Just trying your very best to make this space, block the time off on your calendar, and attend when we do have these sessions. That also includes, to the best of your ability, minimizing distractions. I know a lot of you are taking these meetings from your office, and the phones still ring and clients still come in. But if at all possible, setting yourself aside, letting your coworkers and your family know that you're planning on participating, and minimize as best you can. Actively participating in activities and discussions, I don't see that being a problem. You guys are already doing great at dropping things in the chat, coming off of mute. We're always happy for you guys to come off of mute and share. This is not about just us or just the speakers. We want to hear from you and your experiences as well. And allowing all opinions to be heard and discussed respectfully. That's a big one. We want to make sure everybody feels comfortable sharing and having that space to be part of this program. We don't have a ton of confidential things that come up, but if anybody shares anything from their experience that may be confidential, we want to make sure that we're preserving that confidentiality of our classroom discussions. Like I said, I'm recording this session, but it's only put out to participants. It's not put out there on YouTube or for anybody else to view that is not a participant in this program. The last one that we'd like to say is, when possible, keep your camera on during the virtual classes. But again, we know that technology issues come up, distractions at work or family come up. If you're not able to, we understand that, but we love to see your faces, and we love that active participation part. When we're virtual, it's hard for us to get the feedback from you. And so being able to see faces makes us feel like we're not talking to ourselves. So it's a lot nicer that way. But again, we understand when that's not possible. We talked about the attendance. Evaluations, that's a big part of this program. We do report back to KDHE because that's where our funding is coming from. So when we have evaluations, please do fill those out. Those are super important to us. All of the evaluations that we got from our first group of participants, we use to guide any changes we made to this group of participants. So we do read every evaluation that comes in. They're all confidential. You can say anything you want. We want to hear any feedback you have. So please don't worry that it's going to be tied to you if you say anything you think we might not like. We will take any feedback. I saw you come off mute. Did you have something to add, Sonia?
We honestly made some choices about who's going to be some of your subject matter experts and the order for things based on past evals. We read them, we use them, you influence the way things go. So it's not just a perfunctory exercise. We love them.
Absolutely. Speaking of evaluations, we'll have a session evaluation at the end of each session, including this one. We do also do a pre and post assessment, and that's like your knowledge and comfort with each of the capabilities. That one I will send out. I think I mentioned in my last email, I try to keep my communications to every Wednesday so that I don't overload you. So with my next update email I send out, I will send a link to that pre-assessment that our evaluation partner, Dr. Sarah Jolly, has developed. So please fill that out when I send it to you. Again, I can't see who takes it, but she keeps me updated on how many. And so when the number's low, I can nudge you guys some more saying, hey, I only got 5 results. So please take this. Evaluations communication is also important. Again, reach out to Sonia or I if you have any questions or concerns. If there's a session that you can't attend, again, we understand. Just please let us know so that we kind of have that ahead of time so we know what to expect as we are going into each session. And then we already talked about some of those other active participation. I want to take time now. I'm not even sharing. Oh, I am sharing. Okay, sorry. I couldn't find the stop sharing button. All right. I want to hear from you guys, though, on what you feel makes, what has been a good learning experience for you, and what would you like to see as group norms for this program that would help you get the most out of it? So let me open up a whiteboard here. Hold on one second. And if you don't have experience with whiteboard, we will do a quick orientation to what you're going to do on this. There we go. This is another one where, just like the evaluations, I've made your responses anonymous, I believe. So feel feel free to drop anything in there that you want, or you can send me a private chat if you have anything you want to put in that for some reason you don't feel comfortable putting on a sticky note. If you have never used a whiteboard in Zoom before, I've laid out some blank sticky notes. You can click on it and double click and start typing. Or if you want to grab a new sticky note, over on the left-hand side of your screen, there's a little, it looks like a square with the corner folded up. You can grab that and grab your own sticky note and put it on. But a couple of questions to consider. How can we ensure everyone feels heard and respected? What do you need to feel comfortable participating? How should we handle disagreements or different perspectives? And what behavior will help us stay engaged? I will say that one of the things I struggle with most with facilitating meetings is holding space for quiet, and I'm going to try to work on that. So I'm going to mute myself now and be quiet while you guys take a few minutes to think about this. You can put as many sticky notes as you feel would help make this what you want from this course. I said I'd be quiet, but I have one more thing. If you see somebody else put a sticky note, you can say the same thing as them, or over on the left-hand side, there's a stickers and emojis. If you want to put like a smiley or a heart next to somebody that's already said something you want to say, that's another way you can kind of vote for something that's already there. Monica, if you're struggling or if anybody else is struggling, yeah, feel free to type it in the chat and we can add it as well. And I'm going to give one more minute to get your last thoughts on there.
Someone wrote confidence and understanding what is being talked about, and someone else loved that. And I'm curious if that's confidence as a participant or that your speakers are confident in what they're talking about.
Okay, these are great. I want to talk about a few of them before we move on. But I see some people are still typing, and feel free to keep typing. Or if you think of anything later, send it to us. We want to hear what will help you guys. So let's see. I've seen a couple of things that we can group here as well. Parking lots are a great way to save the topic. I love that. Sometimes I'm trying to think of a great way to have a parking lot in virtual sessions, but we can for sure do that in our in-person sessions. And let's think about that. I haven't seen a parking lot in virtual, but I like the idea. Listening with an open mind. Absolutely. We want to make sure that everybody's being respectful and open-minded to what is being shared. And if we're having any discussions, that those are respectful and effective discussions on how we can move forward from that. Love the breakout sessions and hearing everyone's responses. We do try to do a lot of breakout sessions to let you guys talk to each other and learn from each other as well. As Sonia put in, somebody said games during the sessions to break up the lecture, and we love gamifying our sessions. If you ever have any ideas on how we can do that better, let us know. I saw Jessica popped in Kahoots and Jeopardy. I love Kahoot. My Menti, the foundational feud game, was the free version that I could do in Menti instead of Kahoot. But I love those kind of games. And we have tried to intentionally build in lots of interaction. Have people follow the 3 before me rule, where they wait for others to talk after they shared. That's a really good point. I am bad about that. And with Zoom, it is really hard sometimes to not talk over each other. So I think that's a good thing for us to try to remember is take a break and make sure that somebody is done talking before we do share. Receiving feedback on questions. We try very hard to communicate and make sure that we answer all questions. Sometimes the chat goes by pretty quick. If we ever miss a question in chat, please do speak up and let us know that we've missed your question, because we do want to make sure that we get back to you on everything. That is something I feel very strongly about is if I don't know the answer to something that you maybe email me, I'm at least going to say that I acknowledge I got it, and I'll find that for you. Seeing everybody actively participate and a safe space to ask questions and discuss solutions. Yes. And if for some reason you don't feel safe asking anything, send it to Sonia and I directly. If you don't feel like it's something you want to ask in front of the whole group, we can answer that individually with you, or we can just take that as an anonymous question or comment back to the group without letting them know who it was, if you would like us to do that. Lots of games. We really try. We're really trying to make this interactive. Thank you. And again, if you have more ideas, we would love them to make sure that we're incorporating that. And lots of making sure everyone feels heard and seen. Thank you. Sonia and I hope that we are doing that throughout the course, but we also want to say that's an expectation we have of our participants as well. Please come in with an open mind and help make sure everybody feels confident that they can ask those questions and participate together so that we can network with everybody. And developing a shared mental model. Monica, can I ask you to elaborate on what you mean by that? I think I know I love it, but I'm not sure how to expand on that. Icebreakers at the start of training? Yes. We almost always do an icebreaker. Today we didn't do an official one just because we were already introducing each other, but I like making icebreakers. So we will have those all the time. And I will never ask you, just tell me a fun fact about yourself. I hate that question. I think I saw it was a reel or something. I would rather walk through a room of Legos than answer what is one interesting fact about yourself. I think I did ask you what's something fun or what brings you joy, but I think that's more specific than just give me a fun fact about yourself. Okay, these are awesome. Thank you. If you have more things you want to add to this later, please do let us know. I will compile all these and kind of group them together and share them out afterwards. So this is not something that we just had you do for nothing. we will take this into consideration and we'll develop some group norms for this. So, all right, thank you all. Let me stop that. And okay, then I'm going to go back to, we're just going to talk about a few more components of what this course is. So let me get back to sharing this participant book. I think that's a little better so you see where I'm talking from than just from the slides. One component I want to talk about is the final project. Please don't get anxious about this when we say final project. We're not talking like a capstone project or anything major. What we're really talking about here is that you're taking one of the capabilities that you're really passionate about or want to learn more about, and you're applying that in some way to your organization. So some of the examples of things that our participants in the last group did, they developed flyers for their clients that helped explain a topic that they were really wanting to get out. One of them helped develop a health fair that they had been meaning to do anyway, but this gave them the boost and the incentive to go ahead and get that done. So we really want it to be something that's interesting to you, will help you apply one of the capabilities, and ideally it's just something that you've been wanting to do within your organization or would benefit the clients or your colleagues in your organization in some way. And then all you're going to do is share out with us what the results were from that. We're trying something a little bit new this time around. Actually, I am going to go back to sharing my slides instead. I'm sorry. Me. Now I've got to rearrange my things. I'm sorry. Okay, now we're back to slides. All right, so like I said, we're just we're looking at how you can apply one of the capabilities. And so the way we're going to have you share that out at the end is just a very small presentation, like 5 minutes. I know some of you have said you don't like public speaking. It's just going to be for this group. It's not for anybody else. And you're just sharing what you did in your project. We are also going to give you a template. So it'll seriously be just a plug in your information template where we're going to do like a mini poster session. So if you've ever been to a conference or participated in a conference for a poster session, that's where everybody is sharing what they have done, including the background. So why you were interested in doing that, what the results were, who you engaged with. But again, we'll have a plug-in template where you put it in. It'll be a PowerPoint slide. You just put in your information. And then we'll do really short presentations with the group. And that's how we're going to go about sharing our final projects. Any questions on just the final projects in general before I move on? Because again, I don't want this to be a point of anxiety for anybody. We're not looking for big projects. We're not looking for this to take an immense amount of your time. I know you are busy professionals, and we will help you through this every step. We just want to see how you've applied what you've learned. Okay. Kind of the timeline for what we're looking at here. We'll introduce this more in May when we're together. So we're just doing a quick overview now, but we'll review some of the details and expectations. We'll talk about mentorship here in a minute, but if you choose to be matched with a mentor, this is a great use of that mentorship relationship, is to talk about what that final project will be and how they can help you out with that. In June and July, that's when we would expect you to be developing some kind of proposal that aligns with your passions. And you can discuss that with us. You can discuss it with your mentors. We're just going to ask you for a simple proposal of this is what I want to do, and this is how it will apply those capabilities. In August, I'll ask you to turn in the project plan to us, just so we can get an idea of what you plan to do and help you if you're stuck on how that will align with anything. August and October is when you'll take some action and reflect and do your presentation design. And then in our last session in November, that's when we're going to do those final presentations. So again, no anxiety on this, please. It'll be good. It'll be great. We loved seeing the final projects that everybody did, and what people were passionate about doing within their communities. All right. Any other questions? Yes, and Sonia dropped in the link to the final project. There is a proposal form in the back. So you can see on that final project guide some of the questions that you'll go through as you're thinking about what you're going to be doing for this. All right, perfect. All right,
Before you go on to mentorship, I just wanted to offer, so I have twin daughters, and when they were in college, the first week of school, they had two totally different perspectives. One of them was like, woohoo, syllabus week, because there's just like go and receive paperwork and tell us what you're going to do and like laid back, no big deal. And the other one was like, oh my God, we're going to have to do so many things this semester. There's so many things I have to do, and anxiety girl. And like they both still approach the world that way. And I just want to acknowledge that like we're telling you some things and we're saying, look, we're going to explain it next month. You really don't need to worry about this now. We just want you to be aware that this is what's happening. And I recognize that some of you are going, whew, okay, we'll talk about it next month. And some of you are like, I'm going to go read this form right now while we're in this meeting. And both of those places are great to be. We just don't want anyone to feel rushed. We promise we're going to give you a lot more information.
Yes,
So
thank
we're ready
you.
for other perspectives.
Thank you. All right. The next thing we're going to talk about is mentorship. We believe that mentorship can be a really valuable tool, and that's why we're offering this as an optional component of this program. I have a list of some experienced public health professionals from places like local health departments, KDHE, member organizations, and academic institutions. We realize that not everybody feels like they have the time or the capacity or the interest in having a mentorship relationship. If that's you, that's totally fine. But if you would like to participate in that component, I have a list that we can match you with. Or if you have somebody that you feel would be a good mentor for you in the work that you do, you're welcome to pick your own mentor and evolve that relationship yourself. But I will ask you, I think I said in my next update email, I'll ask who would like to participate in the mentorship component. And if you'd like to be matched with one, I'll provide that list to those that want to participate, and you can choose from those mentors. And it will really be a relationship that's developed by you and what you feel would be best to get from that. So it would be your responsibility to set up meetings and guide the discussion for what would be most helpful for your professional development. Oh yeah, I said by April 16th. So if you want to be matched with a mentor, I guess that's next week. So yeah, let me know. I'll also include it in my update email. And this is just a timeline of kind of when we'll look at that. But again, I will let you know. That comes up.
Wait, before we move on from mentoring, because we've got time. Before we move on from mentoring, does anybody have questions about that? Like one of our measurable goals that we're working toward in this program is for you to build your professional networks, and having the opportunity to choose somebody who could serve as a mentor to you who's volunteered, or choosing someone who's in your organization. Maybe you've wanted to have a mentor for a while and there's someone in, and it's like a super awkward conversation to have. So you're thinking, I'd like to learn more from you, and it's required for this program. And like you could like use this as a reason for having an opportunity to learn from someone. Just want to invite that. This is an extra layer of work for a lot of people to lean into this notion of I want a mentor. And I'm saying those opportunities to have more conversations with people who also care about your professional development are worthwhile. And just want to invite you to really consider choosing to have a mentor. It's an option. It's an option because we learned that for some it was the best thing in the program, and for some it felt like extra. And so we're trying to use that information, but we developed a whole mentorship guide because we think it's that important and just want to really underscore and invite you to consider it.
Thank you for that. Okay, no questions on the mentorship part, but if you think of them later, let me know. We're just going to look quickly at what the calendar is. This shouldn't be a surprise. This is what I sent you in those welcome emails, and it was on the page with your application. However, we have added the topics onto the dates. So as I mentioned kind of before, you'll see a topic next to each date. This is where the capability that we're going to mainly focus on. We did find that with the in-person sessions, sometimes it was easier to get some of our speakers to in-person sessions in a certain location than others. For example, one of our director within our center will be speaking in May about the communications topic, but it didn't make sense for him to drive to Manhattan in August when we're going to be literally downstairs from his office in May. So we're doing a little bit of shuffling for the convenience of having in-person speakers come talk to us, but mainly these are where we're going to focus each month. Like I said, example, next month, we're going to look at equity and the organizational competencies. As Sonia mentioned, we put a lot of thought into who our speakers are. Today, you're hearing almost exclusively from her and I. We'll have a couple more guest speakers come on in just a little bit to welcome you guys, but you're hearing mainly from us. But for the majority of the rest of the sessions, you'll hear from us. We'll be in there. We're still sharing and with you. But we have lined up a great group of speakers who can talk about actually applying these capabilities and what they're doing within their organizations. So we're really excited for the lineup of speakers we have. You can find that in the participant book at the back page. There's this calendar and also a potential list of speakers. I only say potential because they're mostly set, but we might have a little bit of shifting if somebody has to drop out or we decide to bring on somebody new based on your interests. Yeah, so with that, and speaking of that, we're going to go to another whiteboard before we move on because we want to know from each of the capabilities, if you have something in particular that you would just really want to make sure that we cover, we want to hear from you. If you know of any speakers that you're saying, you know what, in communications, I know about this speaker. We can't guarantee we can get that person, but we can certainly try. We want this to be your course. So a little bit of more orientation to Zoom or to the whiteboards. This is zoomed out like 30% right now, just so you can see all of the capabilities. But down at the bottom right-hand corner, you can zoom in. So you can zoom yourself so that you can see that bigger and so you can type on your sticky note bigger. But feel free to grab a sticky note, stick it into whatever section that you're looking at, and let's take 3 minutes to give us some ideas. What is something you're curious about in any of these capabilities, or something you want to make sure that you for sure take away from any of these capabilities? So again, I'm going to back off and be quiet, but let me know if you have questions. I said 3 minutes, but I see a lot of sticky notes that just got put up, and you guys are putting some great things in here. So I want to give another minute or two because I think you took those 3 minutes to think through, which is great. So I'm going to give a couple more minutes here.
Yeah, we have time, and I'm also trying to figure out some interpretations for do we have emergency preparedness figured out, or we just don't know how to ask specific questions about that, or like that's actually an area where we could do some more fine tuning because the speaker group is going to be different than last time. So we have an opportunity to offer more specificity if we knew what would be helpful. I love you, purple post-it note. That's really fun.
Okay, please feel free to keep typing. I'm going to jump in here though and make sure that we have what you all mean by some of these. Okay, learn more about all of the assessment and surveillance, including what your community might need. And that goes along with this other one, how to figure out what my community needs the most. And I think we have some great speakers that will talk about using data to assess those needs. The process of a community health needs assessment, how to maintain relationships at first meetings. How equity gets into all the other capabilities. Absolutely. Equity in the current political climate and what we should be aware of. Oof, yeah, toughie. See, somebody said they want to take the Harvard implicit bias quiz for self-assessment. If you haven't taken that, I definitely recommend you guys taking at least one of the Harvard implicit bias quizzes. Thank you. I was going to go find that link. Sonia just dropped the link in there. I think that's helpful for everybody to take, to know where those biases are in ourselves, so that we can help address those. Strategies and policies to make a difference. Yeah. Recruitment and retention ideas. My board's jumping around a little bit, so sorry about that. Recruitment, setting priorities and following through with them. How to capture an audience and tailor to them. Health department's role in EOP. Can somebody tell me what EOP means? I don't think I know.
Emergency operating procedures.
Thank you. That's not my realm. I don't know. I learned a lot from emergency preparedness last year because that's not something I know much about. Thank you. For other emergency preparedness, what's our role as a public health department? Designing and constructing exercises. You don't want FEP to be lonely. Yes. Like I said, I don't know much about it. And I think it's good for everybody to learn more. And addressing equity. Performance management system. Expanding a professional network. Well, we hope that this whole program helps you do that. Where do I fit in between state and local health? How to advocate and help bring change. Producing and implementing policies. Maintaining policies and templates for policies. All right. I think a lot of what you guys have put in here, we already have speakers addressing, but I'm going to look through these more closely, and we'll make sure that if we don't have speakers to address them, we can at least help you find some resources to connect to that. Because in addition to expanding your professional network, we also want to expand your knowledge of where you can find these resources. As we mentioned at the beginning, we're not expecting anybody to come out of here as experts in any of the capabilities or in the whole capabilities in general, but we want you to know who and what you can go to learn more and how to make those connections within the system, so that everybody's working together to implement all of these capabilities, even if you are not the one in particular that's doing the thing. Yeah, Sonia just pointed out to me that my headers are moving. My whiteboard's set up weird. I don't know what's going on with it. I was trying to figure out a way to set it up as a template so they didn't move, and I didn't do that well. But I think I can see where all of your capabilities go and or your things you want to know go. And as somebody pointed out, what you put in here could go in multiple places. And I think that's going to be correct for a lot of these. So we'll compile these as well. I want to share these back with you too, so that you also know what everybody put. And again, we will definitely take those into consideration for the resources and everything that we do share. All right, I'm going to stop sharing my whiteboard and turn it back over to you now, Sonia.
All right, so Emily just reviewed all of the kinds of things that we're hoping to do. We have a guide, we have this 8-month program, we have resources, we have a website, we have a final project, we have opportunities for mentorship. Are there questions about that before we move on?
Sonia, if there's extra time, I don't know that this is the time for it. Can we actually go and see that website? Because I had logged on to it when you had dropped that in there, and I was like, I can't find anything they're saying that should be there. So can we actually like navigate that if there's time?
Are you talking about the participant resources or?
Yeah, we can do that right now.
Yes, the same thing happened to me. I went to the link and that's not what I saw.
Did you see this?
I saw that.
Scroll. Yep. I don't know why this header is so big, but
I didn't scroll. You're right. I tried to click on the things at the top. I didn't scroll down. So
it's a giant
that makes a
header. I
difference.
can
Okay,
see
thank
that.
you.
Yeah.
Okay,
Yep,
thanks.
I totally understand why that's confusing. And then you'll see that like all of the sessions, and what we meant here was live in Wichita, like live from Saturday night. It's Saturday, live from New York. That's live, not living in Wichita, just as a clarification. I don't know, when I read it this time, when I was like, but that's what we meant. We meant live.
And that's to address the fact that I talked about that our live sessions kind of have a sprinkling of several different capabilities. So we didn't want to exclude those capabilities that weren't the main focus. But thank you for asking that question, because you were not the only one, it sounds like, and I can see how that's confusing.
And will those links be available? Because once we get out of here, the chat no longer becomes available.
Correct. So that website, that resources website link that's in there, that will sit there for the next 8 months. That'll always be there. The website will be. And when you get your Wednesday updates next week, I'm sure Emily will drop that resource. But I mean, I have that page bookmarked because I go back to it so much, and maybe for 8 months it'll be worth a bookmark for you. It is kind of a hidden website. It's not a public link. It's just for people who have the link. And I did not mean to make the balloons go. Not sure why that happened. Put my hands down, quit talking with them. Yeah, so it's available. Other questions? All right, well, we're going to give you one more chance to have a small breakout. And I saw that you guys wanted to shuffle the breakouts, so we're going to do that too. And what I want to invite you to do in these breakout rooms is talk about these 3 questions. So you might jot them down or screenshot or something. And then when you come back, um, we're going to build a whiteboard with some more answers to these questions. So you know, we'll take some notes. That'll be your notes. Thanks, Emily, for dropping that in the chat. So if that's helpful for you. You know, what are you hoping to learn? What is your biggest concern? We find that when we hear about your concerns, we're able to answer questions that we didn't know were out there. So what concerns might you have about this program? And, you know, I'm not going to plant the seeds. You can think about what that means to you. And then what is one thing you think is important for us to know as we start this program? And I'm going to give you about 5 minutes to brainstorm some initial question answers to these questions. And then when you come back, we're going to do a whiteboard together. So I will let you guys reacquaint yourself with your new colleagues, and we'll see you back in about 5 minutes. Welcome back. Okay, Emily, are you seeing the whiteboard?
Yep. It's tiny, but now you're making it bigger.
Okay.
And then a reminder to everyone that you can make it bigger yourself too.
All right, welcome back, everyone. Just getting those last rooms closed. All right. Okay, I hope you all had a great discussion. I want to spend just a few minutes now capturing some of those things you discussed. So similar to the whiteboard we just did, you have a whiteboard you can see now. So we have 3 questions. What do you hope to learn through this experience? What's your biggest concern going into it? And what is one thing you think it's important that we know? You can start anywhere you want. You can start purple, you can start blue, but just double click on any one of those sticky notes that's on the whiteboard there, and or add your own, whatever you want to do. And we'd love to hear some of your ideas. I can't emphasize enough that we believe the wisdom is in this room and we really want your input. So I'm going to let this board go for about 5 minutes. We'll see if that is sufficient. And all of us, at your own screen, you have the capacity to make it larger with a plus or minus at the bottom. And don't know who wrote that sticky note about asking too many questions, but curiosity is my number one value, and I freaking love questions. So I hope we hear a lot of them. All right, just going to give this another minute. You guys have done a great job here. I love these. This is going to be a lot of food for thought for me to think about in several components of our development. And I want to talk about all of them. And that the beauty of this is we have 8 months, we will have chances to talk about almost all of these things. Yeah, I may spend some time writing about reflections on this, and share some of that back maybe during our weekly. I really appreciate the way you guys are so thoughtful and engaged in your commitment to participation and really giving this some real thought. I love the idea that we need to extend each other grace because we're all coming in from a different perspective. Amen. Can I just say that my impatience with myself and others has been one of my biggest challenges in life. So extending grace is definitely something we can all use more of. I'm watching a few more notes come in here. We're going to give this another minute. I've read a couple of notes that kind of fall under the theme of we're coming from different backgrounds. We have different knowledge base before we, as we come into this program, etc. You know, this is something that's plagued everyone in education forever. My daughter's an elementary school counselor, and this is something that shows up huge in kindergarten because kindergartners come in with, like, my granddaughter who's had 2 years of structured preschool and reader family and like all this social support. And then there are kids who have had a different kind of social support but don't speak English, right? So they're coming in with maybe great love and support and no English skills, or there are kids in their classes that come in with home lives that are less supportive. And so they're all coming in with totally different places. And that's true in this room too. We're all coming into this with different perspectives and different passion and different engagement and different experience, or etc. And I will just say that whether this is your first time thinking about public health as a class, or this is like something you're doing in addition to an MPH, we're all going to pick up on a nuance of something different based on the where we are in that moment. I've always marveled. I'm just going to use a faith example. There are many different faith traditions, And all of them have sacred texts, and all of them have people who are 90, 100 years old still reading and trying to figure it out. I don't think any of us gets all the wisdom at once in whatever we're studying. So we'll just all like, whether it's a brand new idea and we're planting a seed, or it's an idea you've thought about 100 times and you're seeing it from a new lens because you're bringing yourself to it differently. I think we're all going to be coming at every conversation with different things to share. All right. Thanks for those thoughts and those insights. I'm going to go ahead and close this board. And I believe we'll be able to export this to share out. So thank you for all of those components. All right, we are at a special moment in time where we get to have a quick introduction and welcome from our friends at KDHE. And our friends at KDHE are in the embodiment of Kendra Baldridge. And I'm just going to introduce her very briefly. She is a licensed social worker, master's level social worker. She began working at KDHE in 2007 and has a Bachelor of Arts in Sociology and Master of Social Work. Both of those degrees are from the University of Kansas. And with as much as you all have heard about K-State today, it's nice to have a KU representative here. In 2016, she was the recipient of the Jane Addams Award from KPHA, and I remember watching that. This is an award for a social worker who exemplifies a pioneering spirit and is a trailblazer and strives to improve the health of the poor and the sanitary conditions of communities. Previously, she was a case manager for the Kansas statewide farm worker program, and then a section director for special populations. And she is the bureau director. Is this still your title? Bureau director for the community. Let me read it just in the words that the order on the screen. Bureau Director of Community Health Systems. Anyway, Kendra's worked for KDHE a really long time, and she is coming to us live from a public health emergency preparedness exercise that's happening right now. And she wanted to have a few minutes to just welcome you and say a few things about KDHE. And Kendra, I'm going to quit talking. Thanks for taking the time and being here.
Thanks for that, Sonia. I appreciate that. Good morning, everyone. I think, yeah, it's still morning. I'm glad to join today and happy to see both some familiar faces and some new faces. So that's awesome. I am coming at you from an exercise, and my boss, our Deputy Secretary for Public Health, is also involved in this exercise. So we are tag teaming, and she apologizes that she is not able to join, but hopefully maybe we'll be able to touch base with you guys at some point along your Foundations of Public Health journey. I'll just say up front, my brain is a little frazzled this morning for multiple different reasons. One of which being we were supposed to do this earlier this morning, and now it's 11:30. But there is certainly a lot going on these days that are keeping us on our toes, and we're continuing to roll with it. So. That being said, Sonia, I'm just going to say some stuff, but if you have specific things you want me to say, feel free to jump in. I will also say, first off, in my stream of consciousness as I'm going here, when I think of Sonia, I think of curiosity. And so I love that I was on in time for her to say that. She is probably the most curious person I know, and I think she's also the person that says the word curious most often, which I think is absolutely amazing. So when she said that earlier, she really meant it. So ask questions, and even if you are like, this sounds ridiculous, she'll still love it. So ask all the questions. And I love questions too. And I strive to be as curious as Sonia is someday. So anyways, all of that to say, I have been at KDHE for a while. 2007, so I think 17 years, almost 18, somewhere around there. But my public health journey actually started before I knew it did. I was a Peace Corps volunteer in El Salvador for a couple years, and I got connected with a health promoter, aka community health worker, there, and we went around and talked with people about breastfeeding and getting dogs vaccinated for rabies, and whether or not they should take the long hike down the road to get their kids immunized. And lo and behold, when I started at KDHE, a few years after that, I found out that I was working in public health. So that was kind of cool. And now, as the Bureau Director over Community Health Systems, I do have 6 sections that I oversee. Some of them you all either interact with or work in, depending on if your name is Afton or not. So our local public health program works a lot daily, sometimes feels 24/7 with our local health departments across the state. We're a decentralized state, and so we have 100 local health departments, 100 local health departments for 105 counties. And KDHE collaborates with all of them in different ways. And we have a lot of programs throughout KDHE. I think like 18 or 19, maybe closer to 20 now, specific programs that interact in one way or another with local health departments. But the local public health program in my bureau often serves in kind of a liaison type fashion, and helping people get connected to the right people when that's needed. Another section that interacts a lot in local public health is our preparedness section. And we get federal funding to make sure that our counties and communities are prepared for when bad things happen, and have plans in place. And that we always say you don't want to exchange a business card in the middle of an outbreak or in the middle of an event. And so trying to get that stuff in place beforehand, and make those connections. The section that I'm working in today is kind of an intersection between a couple of them. Our radiation control program works really closely with the Wolf Creek Nuclear Power Plant down in Coffee County. And today we are exercising if something bad were to happen at the nuclear power plant, which would be absolutely horrible. But if it did, we practice a whole lot to be ready and to be able materials. And so it's kind of a preparedness and radiation mix that I'm functioning in today. And I have a lot of my KDHE staff and then leadership above me that are involved in these exercises. And yeah, so that's what one of my sections, and then where I'm working today. We also have community health access section that works with our FQHCs and rural health clinics and hospitals across the state with different resources. Sorry about that. And then I have a trauma program where we work with our trauma centers across the state, making sure that they have the resources that they need and those connections made. And then the last section is our administrative section, which is kind of an internal one. Then if Ashley Goss were here, she is our deputy secretary and over all of the bureaus in the public health division, of which we have 8 now, I believe. And they all interact with different parts and sectors and partners within the public health system across Kansas, whether it's family health or related to chronic disease, or immunizations, oral health, all sorts of different aspects. Our lab at KDHE, Kansas Health and Environment Laboratories, is now in our Division of Public Health. And so all of that goes through there as well. So department, division, bureaus, and then lots of work that happens in the midst of that. And it's all super cool, sometimes extra stressful, but great stuff. Sonia, I see that you unmuted, so I'm going to see if you have something you want me to say.
I do have one question for you.
Yeah.
And it's about why KDHE invests in these kinds of professional development trainings for the system. So, we wrote this into KDHE, and through the collaborative effort that they did with the whole state, when they were writing the public health infrastructure grant, requested this funding. But KDHE's been doing statewide trainings for the public health workforce forever. You've participated in many, so has Ashley, so have I, many of us have. Like, why does KDHE invest in this kind of stuff?
Yeah, that's a great question. So a couple of different facets that are involved in that. First of all, one thing that we learned pretty quickly in the midst of our COVID pandemic, which we're all trying to put in the rearview mirror and stop thinking about, but keeps popping up every once in a while. Whenever we had interaction with people across the state, particularly providers, but really anyone, if there was even a little bit of public health knowledge before our initial reach out, the conversation went drastically different in a good way. And so being able to have as many people, even just citizens, know about public health and what we do it happens for our benefit in the midst of challenges, and when we're working through whether it's an outbreak or a situation that needs to be resolved in a even small area of the state, being able to have that basis of public health is really helpful. And so we take that opportunity to spread that public health knowledge kind of whenever we can. And this is a great way for that to happen through people that, you kind of applied or at least said you were interested in this course. And so being able to talk with people that want to learn, but that also realize that there is more to learn. And I think to a certain extent, you probably are all curious, or else you wouldn't be here. And so being able to have that opportunity in multiple different ways is really helpful. And then taking that opportunity both for us and you all going forward can only make our public health system stronger. I would also say that, Sonia mentioned, so I'm a social worker. I haven't actually, I studied macro social work, so I don't see clients, but social work and public health are a great intersection in looking at systems thinking and how systems work together. And one thing that I realized and learned when I was getting my master's, which I did while I was working, and I wouldn't necessarily suggest for anyone, but it happened. Also got pregnant while I was getting my master's and working, so that was fun. Is that there are so many different ways to get into public health. And so it is always exciting for me to be able to talk with people. And I came in through I was a lawyer, and then I learned about, and then we have public health lawyers. And so there's just so many ways to be involved that aren't your normal pathway to get into public health. And so the more the merrier, ultimately.
Thank you so much. Does anyone have a question they want to ask Kendra before we say thank you for saying welcome? But does anyone have a question for Kendra? I'm just so excited that you're doing this live from a real exercise. I think it just illustrates the complexity of the job of the state health department and the specific people who in leadership, they're exercising what would happen if something we have to prepare for these kinds of things.
Yeah. In real time.
Yeah. I'm watching the chat for any kind of questions. I'm sure you guys will see Kendra again. Is she available for our future FEP session? She has nominated her lead staff, who I just met because she introduced us. So Natalie will be here to help lead our FEP question. And is she around for FEP questions?
Yeah. Oh, me?
Yeah.
Sure. I do have Natalie Savage is our new preparedness director. And she has been around since about the end of November. She is she's jumped in with both feet and is learning a lot. But yes, I'm absolutely available. I mean, I can answer some now if you have now. But
Awesome.
I'm available later too.
That's awesome. Yep. We will have more KDHE representatives speaking about preparedness and local. Jason Tiller will be joining them to help talk about the local perspective, which is always a good thing. All right. Thank you, Kendra. Thank you for being
Very
with us.
welcome. Great to see all
All
your
right.
faces.
Yeah.
Enjoy the rest of your, I think you're nearing the end today.
We are. We are.
Have a great rest of your day. And I will, Sonia, can you share my email address? I don't know if I can type it fast enough.
Yes.
And seriously, I love talking about public health. I love talking. So feel free to reach out. I would love to touch base with any of you and meet you or answer any questions or ask any questions. So yeah, happy to see you all. And Sonia and Emily, thanks for your flexibility today and for rolling with it. And we'll see you around.
We are delighted to have had you. Thank you so much for being here. She's a wonderful human and a hard worker at KDHE. Thanks, Kendra. I'm going to drop your contact information in the chat, and I'm going to pass the baton back to Emily. Thank you.
That's great.
Thank you, Kendra.
You're welcome. Have a great day, guys.
All right. As Kendra mentioned, we are nearing the end of our time. So I will allow some time. I'll make sure I get some time for any questions that are still burning on your mind, but we're going to preview what's up next. After I do a quick poll with you, let me pull it up. I'm just curious, because I'm a curious person too, and I want to know what foundational capability are you most excited to explore further? You might have a bunch of them. Pick the most excited. We hope you're excited about all of them, but this is fun to see. I'm pretty sure these are pretty close to what we had last time, except we had a lot more communications interest last time. And poor little assessment and surveillance and emergency preparedness has nobody voting for them, but I hope you're still excited.
You want to share the results?
Oh, yeah, sorry. You can't even see them. There you go. You have to scroll a little bit to see communications and emergency preparedness, but I hope you're still excited about them. Even if they're not your most favorite ones, we still have really good lineup of speakers for that, and we're excited to share about those with you. Afton already loves FEP, so she went with another one. That's fair. That's fair. All right. Review for next session. Okay, I have one more. I'm trying a different way to collect this information. So as I said in our email, for all of our in-person sessions, we've already booked hotel rooms. We just need to add names now to those rooms. So I'm going to launch this poll because it's been a little difficult for me to gather names, and I don't want to have to reach out to you a bunch of times like I've done in the past. So I'm going to try this for collecting the information. If you're going to need a hotel room when we're in Wichita from May 7th through 8th, please mark yes and then give me your name. So I'll make sure to attach those to our block of rooms that we've already booked. And if the poll's not working for you for whatever reason, let me know. Just drop it in the chat and I'll make sure you get added to that block of rooms. And then as we get closer, I'll send you your confirmation number so that you know what that is. And I don't need to share results of this one, but I'm going to leave it live for just a second because I have a couple more of you that need to vote, and I do want to get a response from everybody to make sure we have everyone.
While you're waiting and getting that result, just saying, Rachel asked what Kendra's favorite part of El Salvador was, and I got it from her via text message. So if you're interested, scroll back up in the chat after you've already answered Emily's poll.
Okay. Still think I have a couple more of you, but I think when I look at these poll results, I'm going to see your names attached anyway. I only added the if yes, just in case not. So if you didn't reply to me, I'm going to bug you about it because I want to make sure that we get everybody a room who needs a room. And then other logistics for in-person sessions, because that'll be our next one coming up, is that we start at 1 o'clock on the first day to give you a little extra time to get to us. And then dinner will be on your own. We've covered the hotel. We do have breakfast covered at the hotel. And then we provide lunch on day 2. So aside from feeding yourselves before you come on day 1, and then paying for your own dinner, which we'll try to organize a group dinner for you. It'll just be on your own. We've covered the breakfast and lunch for the next day. So hopefully those logistics help you out. If you have any other questions on logistics, let me know, but I'll send out more details on like directions, parking, all that stuff as we get closer to. I will be sending out an email. I'm going to send out, like I said, I try to keep them to Wednesdays. I'll send one following up today just to make sure that you have the link to that resources page. We're going to look at the homework sheet for next time. I'll send that as an attachment. And then I will send the pre-assessment. Please, like I said, do take that pre-assessment. We do rely on our evaluation data. And oh, before I get to that, we want to look at the homework for next time. So let me stop sharing. I'm going to send this as an attachment. It will be in our, hold on, sorry. I had this open and it closed on my screen. Let me open it up real quick.
I can share.
I got it up now.
Okay, cool.
Thank you, though. I just have to change my share.
And what time do we end on the first day, on the 7th?
On the first day, we'll end at 5:30. Does that sound right, Sonia?
Yeah, 5:30.
Okay.
Perfect.
Oops. Close that poll. All right. So for each of our sessions, we do have a homework page, and this is to help you just get some background information for the topics that we'll be talking about. There are some that just say, please review. That's really, we just want you to poke around on those pages and the links that we share to get, like I said, just that little bit of background information about what our speakers will be talking about. There are a few speakers who ask you to complete something ahead of time, but for the most part, it's just getting background information and poking around on those sites. The reason I want to share for May is it looks like a lot, but I promise most of these are just either short videos or just looking around on a website. So you can see, like for equity, we've included a lot of resources because, again, that is the capability focus, but it's also just very underlying what we do in public health. So please look around on these sites, look at the documents. You don't need to print anything, bring anything with you. This is just to give you that information as we go into it. We also have a little bit of a video for financial management. That's one, financial management, workforce development, communications. These are all part of, or workforce, sorry, not communications. That's our like extra one that's thrown in there, and the community partnership development. But these two, financial management and workforce development, are part of those organizational competencies. So please look at those pages. Yeah, just a couple of other toolkits to look at. Again, these are not nothing huge. Don't memorize the pages, print anything out. We did also have some things for further exploration. If you're somebody that wants to just dive in deeper and learn more, we wanted to put some extra resources for you here. These are just things that we think can help enhance your learning and that we have found as resources that go really well with these topics. Are there any questions about homework or expectations for homework? Like I said, we have homework before each session, but we want to make sure that we're cognizant of your time. So nothing intense that we've put in here. I don't know why my hand went up.
Yeah, especially all these things that are optional. Like these are just resources that you can explore. Like under this financial, like on the screen, financial management beam, there's a program. If you really want to learn more about how to be more effective at business administration as a public health professional, there's a course for that. So just these are kind of like just making you aware of things. We've got a couple of people from Wyandotte County. Wyandotte County's done some really cool stuff in the not so distant past around redlining and the effects of discriminatory policies. And that there's a whole We Are Wyandotte webpage that's amazing if you've not seen it. And even if you don't live there, you've probably been there, and the website's amazing. So lots of resources. If you have questions once you get this open and you're starting to do things, don't hesitate to ask.
Thank you. Okay. I said I was going to leave time for you to ask questions. We'll still hang on. We still can answer questions. I do, before you hop off though, like I said, we really, really value your evaluation. So please pull this up on your screen before you leave us today. It only takes a couple of minutes. You can do it right now while we hang on if anybody has questions, or you can hop off and please take it before you move on to the next thing. But we would really appreciate all results. That was like a whirlwind of information today for you guys. We're looking forward so much to seeing you in person. We were really sad that we had to move our kickoff session to being virtual because we want to meet you all in person. But we're glad we get to do it next month. So like I said, we have reached our noon time and we want to stay within time constraints, but we will hang on if anybody has questions. Please feel free to hang on with us and ask them. And for anybody hopping off, thank you so much for joining us today, and we will see you in May.